We'd like to welcome the Marion County Public Health Department in conjunction with on behalf of the Emmanuel Christian Fellowship Center Church, which my name is David Brown and I am a deacon here at the Emmanuel Christian Fellowship Center Church. We'd like to welcome the Marion County Public Health Department for this presentation to our zip code, the 46201 zip code, and all of the wonderful people around here. We're going to go through and kind of introduce ourselves and just kind of share.
My name is Sam Parmar. I'm an epidemiologist at the Marion County Public Health Department. I look at disease trends.
I'm Lawrence Ames. I'm an intern with Marion County Public Health, and I'm also a graduate student in mental health counseling. I do my master's in mental health counseling.
I'm Deidre Coleman, and I'm one of the health educators at Marion County Health Department. And our department, Substance Use Outreach Services, is the department that has been charged with this grant that comes actually from Indiana State Department of Health and through Marion County Health Department. We're able to do these community forums so that we let the community know what's going on in your zip code in terms of the opioid epidemic that is actually a big plague across our country, but more specifically right here in our community. And tonight we want to focus on 46201. So thanks for having us and partner with IPD.
Yes, ma'am. I'm Sergeant David Guard. I am the Community Relations Supervisor for this district.
So like again, I think we welcome you. We want to be glean from each other and learn the information that is going to be presented. Thank you, Super.
All right, let's get started. And since obviously it's a more intimate group, it'll give us more time to kind of engage with each other. When there's a bigger group, I kind of do more extemporaneous talking, but given our size, I think we can engage more with the information that we're going to talk about. But, like we said, we're going to talk about the Marion County drug overdoses in this area code. I'm going to start off by giving you some more kind of broad information pertaining to opioids in general. And then Sam will kind of dive deeper into what's going on in this area code. If I start talking really fast or you can't understand me or need me to slow down or you have any questions, just go ahead and stop me. That's okay. All right. So what are opioids? So opioids are a class of drug historically coming from the opium poppy plant. Some opioids, of course, come directly from the plant, and others are a little bit more synthetic and they're engineered in a lab. And of course, prescription opioids, I think, are some of the more known, what's the word I'm looking for? Like natural, not natural, but kind of, what's that?
Commonly used.
Yeah, yes, thank you. Some of the more commonly used drugs to treat severe and moderate pain, and of course we know things like heroin and meth can also be in that class as well. So these are kind of our list of opioids, and actually last night I found out that we could add something to this list. Norco, is anyone familiar? Norco. So the gentleman that was explaining it to me last night said that it was a stronger version of hydrocodone. He said that he had like some cancer treatment and they had prescribed that for him. So is there anything on here that I'm missing or that you guys are aware of? I feel like every day I have these conversations, these forums, I learn another like term. What's that?
You have carfentanil. You have fentanyl, not carfentanil.
Yeah, carfentanil. Now that's like the horse tranquilizer, right?
Elephant. Yes, ma'am.
And if I'm not mistaken, they're cutting it with the heroin to have a more stronger high. And it's extremely lethal, right?
Yeah, it's, I don't know if you can see it. Just to give you an idea, that amount of carfentanil would kill you.
Oh, wow.
Yeah.
It's just unbelievable.
I mean, stories I've heard and like different documentaries I've watched, different resources I've watched, the dealers who are making this stuff will actually wear like gloves, because it can actually like get into your skin. So that's how lethal this stuff is. And I'm not quite sure where people are getting this. I mean, it's a prescription level.
It's coming from the south,
Yeah.
between burglaries in veterinary clinics and
Okay.
imports from the south,
Okay.
obviously illegally, but yeah.
So yeah, this is just kind of an example of what you'll probably run into, with users. Of course, you got the Norco and the carfentanil, and then we put a few slang terms down there: oxys, perks, bikes. I heard gray death or something like that. I've heard a few others since I've been here.
So are they putting them in stuff, or they,
What do you mean?
like heroin, is it just to shoot up, or is there a heroin peel?
Not that I know of. No, I know you can smoke
Snort
it.
it, smoke it, shoot it, yeah.
Oh, I thought the only usually was.
Not to take over your class, but what generally ends up happening is users generally start with a painkiller,
Okay.
and then either that's not strong enough anymore, or the doc says, no, you don't need it anymore. Flip to street drugs, which again, street pills that they buy, that's not strong enough. Then they go to the heroin, and eventually that's not strong enough, so then they start this other stuff. It's called chasing the dragon.
Chasing the dragon. Wow. Yeah, and these things are incredibly addictive. There's some other drugs out there that have an addictive property, but stuff like, heroin, fentanyl, I mean, they're so powerful that it's in and out of your system. I think the half-life of this stuff is maybe like 20, 30 minutes, maybe if that. And then the stuff is already, coming out of your system. But of course, that increases that high that you have within that 20, 30 minutes. So that's kind of what drives people to chase that, because it's so quick, it's so fast, but it's very powerful. You guys have any questions before I move on?
Morphine, oh God. I mean.
That's old school
It
there.
slows down.
That's old school.
I mean, my mom was on hospice, so during that, when she passed, we called, but they made us put the morphine in a milk, diluted with the milk. We had to pour all of it in there. So that when she passed, she prescribed it, but we didn't want people
Nice to have that.
Well, I mean, just like Officer David said, it's kind of goes with people who may get some type of injury that has pain. They'll be on for a while, and then the doctor will take them off, but
They're already
then
addicted.
they're already addicted. It's all with your brain receptors. So they've normally kind of targeted pain prior to kind of this pharmaceutical boom we had by kind of targeting the exact place, like inflammation and stuff like that. But this stuff is so powerful with your brain that you don't even recognize that you're addicted until your doctor tells you to come off of it, And then that kind of creates like that vicious circle where people try to chase, the dragon. Any questions, guys? So this slide kind of paints a clearer picture as to how serious the problem is all across the country. So while our presentation will be focused on what's going on here in this zip code, I think it's important to realize that this is something that we're dealing with all over this place. I'm from St. Louis, and I know that I've seen a big problem with people overdosing and also just access to drugs on the street. And I know I have friends in different parts of the country, and they say the same thing, that there is really, people are just dealing with the same things all over the place, just easy access, high lethality, and like I said, kind of chasing that high once you get addicted. So our Surgeon General, Dr. Adams, he issued a national advisory urging more Americans to keep on hand and learn how to use Narcan. Are you guys familiar with Narcan, naloxone? We need to kind of talk more about that.
Mhm.
If you want to, yeah. So, and please chime in My understanding is that it reverses the effects of the overdose. So it doesn't necessarily take the drug out of your system, but it binds to, I'm getting super sciencey on you, but it binds to like the molecules within your system to reverse the effects of that drug. But it has to be administered rather rapidly to be effective. So because we have such a large problem with these overdoses, different communities, different governments, different agencies have started offering trainings. A lot of them are free, offering them to the public so people at least know how to administer this stuff if they find themselves in a situation where they suspect someone might be overdosing.
And we offer that training. We offer training to any organization or church or group that wants to get that training. It's for lay responders, and it's very vital because if someone in the church, somebody in your family, somebody in your community was experiencing an overdose, and after the training, you're able to actually administer that Narcan and it could save their life.
The training is free, by the way. Any community member can attend.
Absolutely. So the next, I put a quote, each day we lose 115 Americans to an opioid overdose. That's one overdose every 12 and a half minutes. So that kind of paints an even clearer picture as to how urgent and serious this problem is. Probably by the time this presentation is over, I would imagine at least, according to this, this quote, at least 2 people have died from overdose, just in the duration of this presentation. And then it's time to make sure more people have access to this life-saving medication because 77% of opioid overdose deaths occur outside of a medical setting, right? So a lot of these things are occurring in homes, out in public spaces. I'm sure
Parking lots.
Parking lots, yeah. So
Lots and lots of parking lots.
lots of places where you wouldn't normally have the access to the medical equipment necessary to save this person's life. This is why this Narcan is very, very important.
How is Narcan distributed? Like, how do you get it? Because I was under the impression it's only for like law enforcement, medical professionals.
Not anymore.
And things.
That's changed.
Yeah, through a law called Aaron's Law. It changed in 2016. And so we were able to distribute it and educate lay people, the average person,
Right.
because the epidemic and the numbers began to grow so large. So that way, and the woman who started it and, campaigned to charge her, she lost her son, to an opioid overdose. And so it was very important that she pushed for it. Now it is law, and that allows the average person, a lay person, to get this education. And once you have received the education, then you do receive a Narcan kit. And the kit is valued at like $115. So it's pretty major that their grant dollars now to cover that cost, and it is saving people's lives. It is saving people's lives. So you just really could ask for it. You could take one of our brochures, and that's a service that we could possibly come out and provide that training.
So yeah, I think, I'm not quite sure when the top quote by Dr. Jerome Adams was said, but I know that either it was earlier this year or last year that the president called it like a state of emergency surrounding the opioid problem here in the country. So I'm not quite sure what the trickle-down effect of that is, but that also kind of paints a clear picture for just how serious on a national, federal level this is, that it's getting the attention of our top leaders. But it's definitely going to be a community endeavor. I don't know how much the government can help, maybe put dollars into making more programs and initiatives to tackle this thing, but it's definitely going to be something that's going to have to be collaborated with different community constituents.
Absolutely.
So we're going to move on. Sam's going to come up here and do his part, kind of dive into what's going on here. But before we move on, do you guys have any questions about anything that we're talking about?
Introduce myself again. My name is Sam. So just a quick summary of what I'm going to cover, and then what we're going to cover afterwards. Just highlighting the fact that the opioid epidemic, that's what I'm going to try to prove to you guys, has arrived in Marion County, and just taking a look at the 46201 area specifically. We're going to be looking at overdose deaths, so these are deaths from drug overdose. We're going to be looking at EMS ambulance runs, so ambulance runs for drug overdose and specifically opioid overdose, and then emergency department visits. We're also going to be providing a U.S. perspective when it comes to IMPD from Sergeant Dave.
Lucky.
On his perspective that he's noticed when we're working for IMPD and looking over the 4601 area. So the additional thing that Deidre also brought up was that we do offer lay responder trainings for naloxone if anyone is interested. So a quick look, if we look at the drug overdose numbers across the past about 20 years, we see that in 2017 we had over 280 deaths from drug overdose. And this actually accounted for almost 4% of all of the deaths in Marion County. So that's of all of the deaths in Marion County, that was almost 4%, which is a big, big chunk. This is a 0.4% increase from 2000. If you look at this graph here, you'll see that when it came to deaths due to drug overdose, the number has been increasing and increasing further and further. When we look at overdose deaths for individuals who are from this zip code, we see that in 2012 there were 15 residents from 46201 that had died from drug overdose, and in 2017 this was 23 individuals. 50% of these deaths involved opioids, so opioids, drug overdose deaths are taking a big chunk of the community members away. When we look at overdose ambulance runs, we see that there's a typo here, nearly a 400% increase from 2012 to 2017. So in 2012, we estimated that we had 530 EMS runs where Narcan was administered, and in 2017 there were over 2,000 EMS runs where Narcan was administered. What's important to keep in mind is there's a portion of these runs where the EMS ambulance workers are running again and again for the same individuals, but it's still important to see the impact on our ambulance services, on how many runs they're making and they're administering naloxone for. So when we look at the residents for 46201, we see that they've increased from 54 naloxone runs in 2011 to over 240. So these are residents from the zip code that are overdosing on opioids and then being revived by EMS. And these residents can be going across Marion County, so that's an important distinction to make. These are people from this zip code who might be going and overdosing in the zip code or another zip code across Marion County. When we look at ambulance runs into the zip code, so people who might be coming into the neighborhood and overdosing, we see this increased actually sixfold from 58 to over 350 in 2017. That's from 2011 to 2017. So that's a major increase right there. One of the further perspectives, just to highlight the nature of change in this epidemic, is when we look at our emergency departments. Our emergency departments are also feeling the burden of this epidemic. And we see that it's over 5,200 drug overdoses in 2017, and this is from 1,500 drug overdoses in 2010. So that's a major increase from 2017, where we have over 5,000 drug overdoses, where people are going to the emergency department. Just drawing back another perspective of what about the zip code? When we look at the drug overdose visits to our EDs for the residents from the zip code, they've increased from 328 in 2015 to over 400 in 2017. So there's an increase there. But when we look at not just any drug, but opioids specifically, we see an increase from 66 in 2015 to 86 in 2017. And already in 2018, the number is higher than last year's for opioid overdoses. And one important thing to keep in mind is a lot of the drug overdose visits that we might have to the EDs might not get categorized properly. So there's a chunk of this that might not be appearing depending on what emergency department and what the emergency department is and how they do their reporting in our system. So I'd just like to open up for any questions, any concerns, or any other questions you might have from looking at this data.
So my question, once you are trained with the Narcan and you administer it, do they go to the hospital, or are they healed, or do they, I mean, is it reported that you used it, because like so I have one, and say for instance, I used it on somebody.
You have to call 911.
Oh, okay.
That's
okay.
part of the training,
Okay.
that you call 911.
Okay.
Because actually, the one that you administered may not be enough. They
Okay.
may need another one.
Okay,
To
okay.
bring them all the way back.
Okay.
And so what's happening is EMS will have another one, an additional
Okay.
Narcan with them. That's part of their training, that's part of their gear,
Yeah,
right?
okay, okay.
And so, and that also protects you.
Okay.
Because there's a Good Samaritan law.
Right.
And so a lot of the general public has a fear, and the officer attested to that. We talked about it earlier, that they think that the average person thinks that they're gonna be in trouble if they revive somebody back that, you know.
Or they was using it together.
Right,
They-
and you might have been,
in-
but
in
this
somebody-
law
yeah.
protects you.
Okay.
This law does protect you, but there's a disconnect of information because the general public doesn't feel that way. But that is part of the law, and that is part of the responsibility of having that Narcan, that you call 911 and you get backup.
Okay.
Because many times when they come out of it, they may be hostile, they may be violent, they may be in a state that you can't really handle it because you stopped their high. Think
Oh,
about it.
okay.
And when they come back and they
Yeah.
realize it, they just may react totally different than you're prepared to do. So, it's to your best interest, from a standpoint all the way around,
Okay.
that you call 911, and then, so now you have backup and you got some support.
And I think also from like a more epidemiological standpoint, I mean, it's good to report these things because people are tracking this stuff, to give evidence and kind of have some evidence for what we need to do to kind of target where these things are going on. So
Make it better.
think about it, yeah. So if we don't know what's going on, if we're not reporting these things, there's no way to track it, and that kind of makes it a little bit more difficult for us to focus on where and who and what and kind of all those things.
Yeah, 'cause
And let's face it, if you don't have the numbers, you don't get the dollars.
Right,
'cause
absolutely.
we, like I said, we had 24-hour childcare. And so really in this community, the years that we've been here, over 18, but the years that we've been here in this community, we have had people shoot in front of the church. And then the family members run into the church because we were that type of ministry that we've ended up burying people. We've had services for the community because we're open to the congregation, the congregants. Now, a lot of us don't live in this zip code, but we attend church here. So, like we, live in a different zip code, but a lot of us, we have Avon and everywhere, members from everywhere.
And I think being trained with this information, and even because I want to look and encourage some of the other congregants, this Narcan training, just to be equipped with this information to be able to share, as well as have that training, because like I said, a lot of people look at the church as a safe haven. We have people come down here and get us for things that I tell them, you need to call 911. I'm not law
They want
enforcement.
prayer.
You won't, I'm gonna
I'll
pray for you, but you need to call 911
too.
Yes, you need to call 911. Let's be realistic.
That's right.
So I think that that's why I'm just so sad that more people are not here, because like I said, this is much needed information. I mean, and this is just real, like I said, working in the school system and working with inner city youth and things like that, and I see the impact it's had on their lives, because they have parents and uncles and aunts and
That's right.
other caregivers that are addicted to these things, and
That's
even
right.
either boards of the state, or simply they're out here on their own raising themselves.
That's
Yeah, I
right.
think you make
That's
a
what it
really,
is, too.
to just kind of bounce off that, I think you make a good distinction between kind of how big the problem is in the actual addiction itself. Because many times what you'll notice is that the addiction is just one piece of a much more convoluted, compounded
Absolutely.
problem. You know, so once you try to focus on the addiction, you also got to figure out maybe there's housing issues, employment issues, behavioral issues, mental health issues, you know. So I think it's also recognizing kind of the holistic approach you have to take when you're dealing with this, and also recognizing that you know, you're seeing their disease process with the addiction, but that's also just one piece of the
It's one
puzzle.
piece of it.
You know, it's a lot of compounded environmental.
Because I'm just sitting here thinking, what do Lyft and Uber drivers, because the people get in you don't know what they're on, they get in your vehicle, and if you're not trained in it, you know, we got, you know, like I said, we got some deacons and stuff that drive.
That's why you call 911?
But, you know, or driving them to, you know, I mean, because like you said, what they act, if they're really belligerent, or, you know, or,
Well, I'm gonna give,
Hold on a second.
this is an excellent partnership that we've had with IMPD.
Yes, ma'am.
And we just really appreciate you coming out, taking your time this evening, and we want to give you a chance to speak, please.
Well, again, I'm Dave Guard. Since we really don't have anybody from the community, I won't get into crime trends around here. So I'll just get into what we in law enforcement see with the opioid issues, specifically heroin. About 3-4 months ago, I pulled the runs for 2 weeks, and I can tell you that we respond to, on average, 3 or 4 overdose runs every day. Every single day on this district alone. I'm going to guess, since I don't think anything's changed, that that number probably still stands. Now, a lot of them EMS, actually most of them EMS, either get to before us or like within a second or two of us. We only end up administering 1 or 2 Narcans a week. Some weeks we don't administer any, just because our EMS is really good and really fast. So I think that helps a lot. The major issue that we deal with is the collateral damage from it. Because they're addicted, they can't maintain a job. Because they can't maintain a job, they can't maintain a home. Because they can't do any of that, they're out stealing to support not only themselves, but their habits. So it's just a trickle-down effect that just absolutely affects every single person in the community. Even if you don't have an addict in your family, you're affected simply because of the addict's actions. Not only that, but taking us away from our job of enforcing laws and finding the bad guy. We're now being pulled on a lot of these EMS runs. As a matter of fact, every single overdose run that the medics get, we have to go on. Because of the possibilities of a crime, because of the possibilities of the person refusing to go to the hospital, which we don't allow them to do. You were asking that question earlier. Once a person has overdosed and EMS has, or we have brought them back, most of them will try to refuse to go to the hospital. We do not allow that to happen. They can go on their own accord, or we can place them under what's called an immediate detention. So we force them to go to the hospital even if they don't want to. So that's not even an option, which is why, another reason why, when they have what they call these Narcan, you can come on in, man.
Please.
What we call these Narcan parties that they're having, they don't call EMS. just revive each other, and they hope it works.
So they actually have Narcan part.
Yes, ma'am.
Wow.
And that kind of gets into kind of the discussion that we were having earlier about what may be kind of, I don't know what's wrong with it.
Just say it, man.
I'm trying to, it may be, Narcan is a good thing, but it could be producing or creating an environment where it might be, it also might be enabling. You know what I'm saying? Yes, yeah. It might also be enabling behavior, because if I'm an addict, we're all addicts, and we have the device that, well, we can get as high as we want, and we have the device that's gonna bring us back. Well, that's perfect. That's the perfect storm for using, because now, like I said, we can have these parties, we just get high all day and just, hope that it works.
Yeah.
And I was talking to someone yesterday at the community forum that we did, and they said that with these stronger drugs, people are actually trying to OD. I guess that suggests that this is the strongest drug that's going to make me feel the best. So when they find out a person OD'd on
This dealer's dope.
right, then everyone wants to get to that.
For the adrenaline rush or just?
For the high.
For the high.
When they find out they OD on a specific, they want.
That means that dope is some really good stuff.
Wow.
You gotta remember, and it's not just with heroin, chasing the dragon, what addiction actually does to you.
Mhm.
In a nutshell, every high is less and less. So in order to compensate for that, every use is more and more
Mhm.
to try to get that first high.
Right.
That's the addiction. So where 1 milligram of John Doe's dope might give me a little buzz, 1 milligram of your dope might put me out. Well, I want your dope. It's just,
And it's the addiction.
It's crazy.
It's a disease. It literally changes the way your brain functions. So that's why I try to explain to people when, they are dealing with someone who has an addiction and they're going through all these like behavioral issues. They can't understand, well, why don't they just quit? Or, why do they care more about this drug and then all these other things in their life? It's because this drug is actually changing the way their brain functions, right? Our brain is built, it's a system of neurotransmitters, all types of things that come together to create what we experience, our thoughts, emotions, our drives. For the most part, those are normal, but when you introduce drugs, that changes your entire physiology, and it's very difficult to undo that damage. And that's why you have people who are chasing this high, and then and a lot of times avoiding the withdrawal symptoms.
But as a police officer, when they do, you said you could do multiple runs to the same house? I mean,
all the time.
really?
That
So
don't-
there's no limit? I mean, they don't get arrested? I mean, for, like, if you
Well,
4 times?
Many years ago, we would arrest on cases like this. But what we found is all we did was overload the jail system and the court system.
And so if they
It absolutely, we cannot arrest our way out of this epidemic. Now, some other states have resorted back to that because it's so bad. They're actually, and matter of fact, there was an appellate court ruling here lately, they're actually arresting these people for possession, which is a felony, because of the overdose. There has to be some other circumstances that go along with it. But we're kind of in a tight spot. What's your first name again?
Sam.
Sam here, he's the neighborhood dope, so he's getting high all the time. He's living it's called a bando, an abandoned home. He's living in a bando right down the street, and he's still in the neighborhood blind. We brought him back 6 times this month. Neighbors get tired of that. You gotta do something with Sam. So now maybe we do arrest him. I mean, there's just no good answer is the problem.
'Cause we
And until Sam wants to quit, he wants to quit, you can't do anything for him.
Because we had somebody break in our church and they went in our candy store. And, you know, they came through a window and they, you know.
That's the other thing I was gonna say. I can tell
They
you,
were on that.
just, I have no statistical information here with me. But I can tell you more than 90% of all of our crime in this county is either alcohol or drug related. One way or another. Either because they're on it or because they're needing it.
I guess my own personal opinions, I'm not quite sure if, I mean, something has to be done, you know, it's so urgent. I think the numbers that we saw and also kind of the information that we got from across the country kind of shows us that it's a very urgent issue. I take the more, I'm a counseling, mental health counseling student, so I take the more person-centered, like, you know, I don't know if incarceration is going to treat the addiction, you know.
Only if there's a lot of stuff that goes
There's a lot of
with it.
stuff that goes with it. And then, I think that also creates more of a burden on the public than taking more of that preventative stance, which is kind of what this is about. More burden on the public in the form of, you know, overwhelming our resources, having to house these tax dollars, having to house these people, just the whole 9 yards, you know. So, but it's an urgent situation. It's an urgent situation, and it is, possession is a felony, right? So it is, I think, one. And this is my.
It's level
I'm-
6 right now.
Yeah, this is my personal opinions because I've spent a lot of time thinking about this stuff. Because it's affecting our community, you know. And I do find myself saying like, well, maybe if they're in jail, they're not hurting themselves, you know. They're in
That's
this
not true,
place.
because you get just as much
Right.
help in jail as you
Right.
can anywhere else.
Right. So, you know, which is incredible.
To me, I'm all,
So-
and again, I'm a cop, so this is coming from a cop. I'm all for incarceration. I think part of our problem in this country is that people really aren't held accountable anymore.
Right.
Now, caveat to that is while they're incarcerated, we need to be working our butts off and putting more money into helping them out. Through
Right.
counseling and addiction issues and mental health issues. They need to be held accountable, because you commit a crime, you need to be held accountable. You know, when we were growing up, you did something wrong, get your butt whipped. We've gone away from that. We've gone away from holding people accountable. I can tell you right now, in this county alone, I can go out and rob 15 daggone stores with a gun and beat people and do all kinds of stuff. Get caught, come in, do what's called a cleanup statement, confess to all of them so they only charge me with one. I might get sentenced to 15 years, 12 of it suspended. I might do a year and a half in jail.
Criminals know that.
And they know it. Let me tell you something else. Boy, you got me going. Let me preach.
Come on, Dave.
Do you know that the surrounding county criminals come to Marion County to commit crimes because they know that our criminal justice system
I've
is
heard
lighter?
young people in the school say that, man, why? Because a lot of the school I work in, the population, it's about 300 kids. Half of my young people are on electronic monitoring.
Oh, yeah.
We have so many on
Oh, I'm
electronic
gonna go on
monitoring.
the juvenile
We keep
system.
We keep the chargers at school so they can stay in school and not go out. Probation officers call up there all the time, it's such and such here, or they may pop up, so I deal with that. And I've heard them say that, man, you commit crime in Marion County, and these are teenagers.
Yeah.
I've heard them say
It's
things
known.
like that.
It's known.
I just wanted to interject one thing. One of the things that substance use outreach services is doing is providing treatment. And that's major because
Yes.
there are very few organizations that have dollars for treatment. Treatment is expensive, okay? And so we pay for residential treatment and detox, and that's huge. We have a partnership with Salvation Army over at Arbor Light. And,
That's my family member.
okay, very good. And
Been clean for 6 years.
yeah,
I
so
know
people
somebody
are
else
ready
who
to
do
be,
that and it works
ready for
fine.
treatment. It's just important that they have a place that they can go. Because everybody doesn't have insurance that will pay for it. And so when you have the people or individuals, loved ones, whatever, people that you know that are ready for treatment and that they can get in treatment. And we talked about this earlier, because a lot of times 24 hours makes all the difference in the world. So that is a service that right now is huge, and that we take pride in. We have 2 case managers that screen and assess if they qualify, they can get treatment and have that treatment paid for. So
Good.
that's
Ma'am, I know, did you have any questions of us? You sure? I'm not trying to front you or anything.
Something that we spoke a little bit about at the forum yesterday, that I think is relevant to kind of what we're discussing now. And this is kind of also my personal opinion. I think we may have to also reframe how we approach addicts, right? So for me, I approach addiction as a disease. And when you have a disease, you're not a bad person. You need help. I think that is a more person-centered approach. Now also, you have to be held accountable for the things that you do. That's just a part of development and growth and getting better in and of itself. But also creating a space where there's not as much of a stigma. So I think people who may want to get help, but they're kind of struggling with dealing with that stigma that kind of our society places on addiction, along with some other systemic environmental issues. I think that is what makes people reluctant. You said that you know some people who were former addicts. You said you had a family member who was a former addict. I think some of those people make great foot soldiers and allies for doing this frontline work, because what a gentleman was saying yesterday, he was also a former addict, and I've never dealt with an addiction, so I obviously don't have a perspective that lends itself to understanding what people with addictions would go through, but he did have an addiction. He was a former addict. And he said that maybe enlisting and invigorating people who have gone through that before with this work and kind of getting them on the ground and helping out could also be a way to dealing with just this problem that we're seeing. Just making connections, and also just the way we reframe addiction in general, I think will be a big step forward, and at least getting people to be a little bit less reluctant to seek out services.
Oh, because that's why, even to me, the stigma even in churches is that because we know Mother so-and-so or Saint so-and-so, but they got a Junebug or they got a Tanika or Shaquila in their family that is dealing with. And so, but we don't want people, because we're not educated enough, or we don't know what it looks like. Because now you have functioning people, that are addicted to whatever, but they function normal. Or you just take it as though they're having a bad day because their attitude is on and off, and so they're having a bad day and those type of things. So, those, I think that's a stigma in itself to disclose that, I'm an addict, or that I have a family member that's an addict, or because I think that every one of us knows somebody, whether we admit to it or whether we
Every one of us, absolutely.
or what it looks like, I was at the marathon up here on Prospect, when I was passing out loud, because they were sitting out on milk crates on a Sunday.
Sure.
And I was like,
Yeah,
not to judge, I was just
Unfortunately,
like,
that's our homeless population, which it
you know,
is. That's a whole nother issue.
but they
Whole nother issue.
But to Lawrence's point, they have a program, Sam was talking about it earlier at Eskenazi, called Turning Point, Project Point. And when you go in and, like Officer Davis said, when you have to go to emergency after you've been treated for Narcan, brought back from a overdose, right? Let's say you go to Eskenazi, there's an addiction person right there, and usually they are someone that was formerly an addict that they have working there in that program, so they're able to talk to the people and able to get them into treatment right then. And so that's been a very successful model too. And hopefully other large hospitals will adopt that same kind of model, because it has proved to be very successful. And you're right, a lot of times when a person is an addict, and an addict is talking to them, just like an alcoholic or anyone else, you know, you can receive the message better.
Absolutely.
One thing I will caution though, to remember, and we brought this up yesterday as well before, that, you know, you don't stop being an addict. You're always, it's always kind of like a day at a time thing, you know, and you're always trying to prevent relapse. So, you know, with these former addicts who are working in some of these addiction, substance use centers, they also have to keep themselves under control.
Yeah.
You know, because I mean, for a lot of it could be like PTSD to an extent. You know, some of the things that they're discussing with the current addict could trigger them. You know, so that's another thing to keep in mind. And also, I think it's important to be an advocate. We've been talking a lot about just how strapped we are for resources, and how one of the problems is there's just not enough people, not enough money that can accommodate for everyone that needs help. And I think, you know, coming to forums like this, going out in the community, but also speaking truth to power is very important. Whether it be, you know, writing letters to your congressman or woman, or advocating on, you know, at the state house, or doing whatever you got to do to make sure that the people who do have the ability and the authority to write checks and get different initiatives and things moving understand that this is an issue. And this is why, and we care about it, you know, and you should care about it as well. This is why we have things like this with numbers and data, so they can actually see, like, this is what's going on. But if we're not advocating for the people in the community that are having these issues, they're not going to advocate for themselves. They can't, of course not, because they have that problem, you know. But I think it's very important to speak truth to power in that regard, but also to understand, I guess, the community responsibility. And tag people, you know, bring people in and say, you know, we can really use your help with this. You know, we can really use your help with this. And recognize that addiction is only one small piece of the problem, but it's definitely a part that we gotta focus on. I'm not quite sure, you know, I thought about this before I came over here. How will we target children regarding the opioid crisis versus adults?
Well, we had a youth component.
We had a youth component.
We have a youth component.
Absolutely, but I'm trying to understand just kind of more of the process that a child will go through when it comes to understanding drugs, you know. So I think we may need to have a different approach with targeting, and I'm not talking about what we did, I'm talking about at the community level, targeting kids.
The first thing you have to do is get parents to get involved,
Right.
or guardians.
Yeah.
Because you can't even get them involved in the education,
Right.
let alone bring them
Well-
to something.
We have here.
Yeah, it's not like
Yeah.
it used to be.
What's that? What'd you
It's
say?
not like it used to be.
It's tooth and nail to get parents to come and see about their children that's
Yeah.
misbehaving in school, that's failing. And, you know, I have sophomores and juniors and seniors that have freshman credit and things like that. You can't get them to come up there, but I bet you if Miss Latasha takes that iPhone, that she's coming to get those, you know. So then at that time, I have to call the counselor, the guidance counselor, the principal, the social worker. She's on her way up here, hurry up, hurry up. So everybody got to stop what they doing, because we're gonna bombard you at this point, and you're gonna be mad, but it's okay, because you wouldn't come. So you get in there, you come in the office, there's 12 people in there, because it's the only time, because you're coming to get that iPhone 7, but your son is not gonna graduate.
Wow.
It's just like unrealistic,
Right.
It's a
so,
little Johnny effect. It's what I
Yeah.
call little Johnny. Seriously, little bitty Johnny, I'll try to make this real quick. Little bitty Johnny, does something bad in the neighborhood to a neighbor, throws a rock at the neighbor's window. Neighbor takes little Johnny, takes him over to guardian, I'll just say guardian, because it's not all just parent, and says, hey, little Johnny threw a rock at my window. No, he didn't, you better get off my property. That's first. Little Johnny gets a little bit older, does something a little more serious. Neighbor goes and tells guardian, hey, little Johnny just slashed my tires. My little boy don't do that. You better get out of here. Little Johnny becomes a teenager,
That's right.
more serious. Now he's never been disciplined, gotten away with everything. Now he don't understand why police are chasing him down the block.
Right.
parent, guardian, steal. My child would never do that. Now, I love my kids, but I am not gonna get on the news and profess that my child who just shot and killed somebody was changing his ways. Oh, he would never do that, he's changing his ways. Bull. He shot and killed that person. I love him to death, I'll visit him in prison. But that's where we're at.
Yeah.
That's that accountability thing we were talking about earlier. And it's the same way, you know, we don't even hold doctors accountable. Now, I get it, you know, I actually been to a couple symposiums with doctors. Originally, when all this OxyContin stuff came out, they were told by the people who made it, oh, no, this is a non-addictive narcotic, everything will be fine. So that's why they pushed it in droves. And they fueled this epidemic that we're in right now. Now, they're trying to reverse that now,
Well, we deep in it.
but we so far in it.
I think, you know, we might have a little bit of a drug culture that doesn't lend itself to helping with this problem.
Oh, absolutely.
You know what I'm saying?
We've always had
Had a
that.
drug culture.
Always had that.
Alcohol,
Yeah.
drugs, so.
So so to chase a high or to chase something, what is it to escape from the reality of
A
life?
multitude of
Or is it
reasons.
just,
I mean,
you know,
It's a multitude of reasons.
to
Depression, mental illness.
pain?
I think that
pain.
I think mental illness is a big component. I work for mental health agencies and things, and I believe, this is just my opinion, a lot of people become addicted because they're having their own mental issues. And then a lot of cultures, you're taught to keep your business to yourself.
Yes.
Privacy, so it's no trust, there's no trust in the therapist. I'm not going to a therapist and telling my business and things like that.
Absolutely.
So then you got all this depression, anxiety, all these things that you can get help with. You just self-medicate because there's a stigma.
Yep.
We don't do this. Don't tell the family business.
Yes.
We're not going to a therapist. We're not putting it out there like that. And then you make a far bigger problem, and all you have to do is go see a
Yes, ma'am.
psychiatrist, a therapist or
Yes,
something.
ma'am.
Or you got Vicodin, you got to order a Vicodin, and so now your tooth ain't hurt no more, whatever you took it for, and you give it to your siblings, or you give
Or
it to
they take it,
somebody.
or whatever. This lady at work today told me her original prescription was 109 pills.
Yes.
And I was like, how can anybody give you 109?
Because they give like 90-day supplies. I've had
Well,
parents.
they're starting to stop doing
Yeah,
that now.
like 7 or 6,
Yeah.
you know, but they back it all the way back. But by that time, if you got 109 pills or 59 pills, and you were used to getting 59 pills, and you really might have just needed 20 or
And you
20.
only
Do
supposed to
they
take
sell-
2 a
do
day,
they
but you
sell
take
the
8.
others?
Yeah, you sell.
Do they sell them?
Oh,
yeah.
Well,
Well, the simple hydrocodone on the 750s, you know, they're only going for a couple bucks a pill, but you start getting some really heavy Percocets, Vicodin, things like that, the Norcos. Depending on where you're at in the city, it can be 50 bucks a pill. Oh, yeah.
That's
Yeah,
what
that's what I
the kid in
heard.
school
That's
told
what
me.
I thought
I
too.
never heard.
I hate to cut everybody off, but even before I take off, has anybody got any questions or anything?
Hey, can I have your card? Yeah,
Dave, you got pen and paper.
Yes.
David, D-A-V-I-D, dot, guard, G-A-R-D, at indy.gov.
Okay.
Excellent.
Bye, y'all.
Okay.
See ya.
Yeah, good to see you.
Because my pastor is on the 10-point coalition board.
Okay.
But I hate to get the.
You can get a hold of me anytime.
Yeah.
All right.
Thank you, Jay.
See ya.
So, yeah, that's all I really have. I mean, you guys are armed with some good knowledge, right? So I
Oh,
think,
you know, I mean, I've been educated, because like I said, you just assume and you hear it, and like I said, I think the stigma is that I don't have anybody in my family, so it's not interesting, but it's just like HIV or anything that, you know, that is a disparity, infant mortality or whatever, all the topics, because that we just don't know, because, you know, we
And
do.
even though I don't see it like per se up close and personal, I see the impact
Sure.
building in the school system. The lack of food, we have to have a food pantry,
Yes,
you know, at our schools, you know, just different things. I see the overall
yes.
impact.
Yeah, absolutely.
You know, the kids being placed from, you know, bumped around from place to place, you know, and that's why I do counseling and things, and I deal with a lot of behavioral issues, but sometimes I have to stop to understand where the kid is coming from, because if your parent is on drugs and things like that, and you're probably having a bad day because you got 4 little brothers and sisters that you had to get out of school and go watch, figure out how you was gonna feed them, and one of the brothers and sisters is a 6-month-old baby, and you didn't get any sleep all night. So when the teacher tell you to lift your head up in class, you spaz out. You're gonna get a consequence because that's not the way that you deal with the teacher, but, you know, you gotta get to how can I help? What can I do? These are the resources I can provide, you know, for you to help you, to try to be resourceful and stuff. So just seeing the overall, and that's why I think it's so interesting, the impact of this opioid epidemic on society. It's dreadful.
It is, absolutely.
And I think it's sad because for the most part, it's preventable. You know what I'm saying? So that's what makes it so frustrating. Now,
But people are ashamed to seek out help.
right, well, it's that stigma, that reluctance. And once the addiction takes over, it's hard. You know, it's hard for people to even consider going through what you have to go through to get clean. I think, like I said, people try to avoid withdrawal. Like, there's so many different factors that drive a person to even start drugs but then continue. But for me, it's like, it's preventable. You know, it's so preventable.
But they are addicted by then, Lawrence, and what one of our clients told us is that, so they were hooked on the pain pill, but see, heroin is much cheaper, so they can get a high heroin hit for as low as $20. And that might be 2 hits, because one of the ladies was saying she could steal a bike, take it to the pawn shop, and get $20 for this bike that was just sitting on the back porch. And that could be a hit for him and a hit for her. Whereas,
That's how people are
but
thinking.
they got addicted to the pain pills that was prescription, right? But then the heroin is cheaper, but that can, you know, that can sustain that high, that can fulfill that, like you said earlier, it's self-medicating. So as we begin to look at the whole picture and wrap our arms around it, you know, we just need to see it from the different lenses.
Absolutely.
So that we can understand, kind of to your point, of the young people, you gotta see the whole picture if we're gonna really be effective. But we definitely have to work together, the churches, the schools, the police department, the health department, so that we can come up with some solutions and get to hear from you. And to Lawrence's point, we had a concerted effort where we talked to young people because we wanted to hear prevention messages from you. And of course, to be young in 2018 and dealing with these epidemics and the things that's going on, we can't speak for you. You have to tell us how it feels, what you see. You understand what I'm saying? So your voice is very, very, very powerful in this mix when we try to wrap our arms around solutions and how we're gonna heal our communities, because y'all are a very vital part of it. Plus you're the next leaders. So your voice is just so, so powerful, because young people listen to young people. They do.
Yeah, I do want to make kind of a point along that. Something my mom used to always tell me when I was growing up, and it was super impactful. She used to tell me, don't be a follower, be a leader. And she was right. She was like, she used to say this to me, she was, if you follow somebody and y'all end up going to jail, don't call me, because I ain't taking a follower out of prison. But if you led people into jail, then call me, because I might be able to work with you. That's what mom told me. Yeah. I mean, and when you're a kid, it's like, what? You know what I'm saying? But it was so impactful because every time my friends would do something that could have led to a situation or doing drugs or something, I thought of that. Don't be a follower. I feel like you have a lot of kids right now. I mean, it's just going through adolescence. Kids are going through development, so you have to give kids room to grow. You know what I'm saying? But also instilling in them the confidence to know that you don't gotta do that stuff because everyone else is doing it. And I feel like kids aren't getting that because, like you said, you know, they have parents who are uninvolved, They're not getting the self-confidence and the attachment that they need to know that I don't gotta do that stuff to fit in. I don't even fit in with my family, the people who are supposed to be protecting me. I don't even fit in, they're nowhere to be found. I have a group of people, yeah, we do drugs together, but I fit in somewhere. I mean, you know what I'm saying?
Yeah.
So I think there's so many different lenses that you can approach it, but from the kid standpoint, I think it's really letting them know that you don't gotta be a follower, but also being compassionate. We get frustrated as adults when kids do the things that they do, but I think we miss out on a lot of learning opportunities with children.
Just
We don't
listen.
Just listen. No one does, even a child, nobody does something for nothing. There's a reason, there's a function to every behavior. And because in our society we're very quick to be punitive, I think we miss those opportunities to really figure out what's going on in a child's life that might be exacerbating this behavior. And to be completely honest with you, many times kids just want to be heard and acknowledged and have their feelings validated, and we don't do a good enough job as society in validating the knowledge of kids and also the foresight that they have. Children are very smart. We don't give them enough credit for that. And I think we need to kind of go where they are. And we also need to understand that, I mean, I'm a millennial, my phone's right here. Kids are addicted to their phones. We're not going to change that. I think a lot of people from older generations have a hard time adapting to that phenomenon because it's just not something that you had growing up. You know what I'm saying? So you were socialized in an environment that told you this is what success looks like. Phone away, those times are changing. And just because, you know, there might be a disconnect with kids in terms of, you know, they're addicted to their phones or the music or whatnot, you know, this, that, and the other, we have to be adaptable in understanding how kids respond and how they learn. We have to know where they are. So one thing I tell people is find ways to engage kids through their phone. If they're on their phone all the time, don't get upset because you can't get something out of them. Find a way to engage with them using how they communicate. Go where kids are. It takes a little bit extra work, but it's necessary because we're not, the problem is too urgent, right?
How about you said in the beginning that you've never been addicted? You just admitted that you were addicted. I mean, it kind of works the same way. As I mean, you know, because it's something that you got to have. It's got to be here.
Absolutely.
So, I mean, it's the same kind of principle. Addiction is across the board. I mean, it's because when you said that, I just kind of thought, wow.
No, you're right. I don't think I have withdrawals. I don't think I'll start. The phone is away.
Can you put it in another room and go to sleep?
But
Can you sleep without your phone next to you? Not on the nightstand.
But you know, I don't think that as far as generational is concerned, I mean, there's kids, I didn't get my first phone until I was 14. I mean, there's kids now who have like, who are 5, 6 years old with phones, you know what I'm saying? So just recognizing that some of the techniques and ways that you reach children in particular have to change. You have to recognize where kids are, how they communicate, and go where they are. You know what I'm saying? And that takes more work, that takes harder work, but it's necessary. And also just making sure that every opportunity that you get, let a child know that they're still important. A lot of these kids in these situations are stewing in depression, low self-esteem. They're going through those environmental factors on top of the physical changes that they're going through. And that's an incredible period. So it's hard, and I think it's asking a lot of these kids to bear that burden of going through those environmental factors, you know, low income, family situation, drug use, while also becoming an adult, going through adolescence. So any opportunity that you get to tell a kid, like, yo, you know, you're loved, you matter, and we just want to see you succeed. Any opportunity you get, even through punishment, punitiveness, use it as an opportunity to reinforce positivity and really get these kids self-esteem up. Because once they love themselves, and they know that they're worth something, because they're not getting that messaging from their family, their neighborhood. Once they know they're loved and they know that people care about them, it's much more powerful for keeping children on the right track. Now, everyone makes mistakes, right? Give kids room to grow, but always recognize when there's an opportunity to help them learn. And then you can start tackling some of these other issues, right? That's all I got though.
Oh, thank you, Lawrence. So Lawrence, he has training as a social worker. He's going through the social worker master's program, so his perspective is very important when it comes to these issues. I would just like to highlight this flyer that we have here. It's a little one-page brochure here that highlights some of the services that our health department, Marion County Public Health Department offers through our substance use outreach services program. So there's HIV, STD testing, there's, as Deidre referred to a little bit earlier, treatment services program, linking people to treatment. And also, there's also educational material that we offer as well for people who might be interested in maybe perhaps reaching out to their community and maybe distributing some of this educational material or maybe speaking to someone on a one-to-one level. So I'd like to thank all of you guys for attending this community forum. We do have food left over. We have sweetened and unsweetened tea and some Chick-fil-A left over. Please feel free to take some of that. Thank you all.